Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. Today we will look into one of the important topics, signs and symptoms of HIV and AIDS. Basically, AIDS is divided into three stages. In these three stages, we will be having different types of symptoms. First one is acute HIV infection. Second one is chronic HIV infection, and third stage is AIDS. So, first stage, that is acute HIV infection, lasts from 2 weeks to 4 weeks. Chronic infection lasts from 1 month to about 10 years. After 10 years, we will be landing into AIDS. These three stages will have three different symptoms. So we will be looking into the symptoms of each and every stage. First stage, what will have? You will have within 2 weeks to 4 weeks, you will have fever, you can have chills, you can have sore throat, you can have muscle pains, or you will get sweats at night, you will get rashes. Sometimes your lymph nodes are swollen, maybe your inguinal or other lymph nodes are swollen. Sometimes you will get ulcers in mouth, you will have cough, you will have cold, you will have body pains, some kind of weakness in your body, some vomiting sensation or vomiting you will have, nausea, running nose you will have sometimes, and nasopharyngeal irritation. Or these are all the symptoms that you can see in the first stage of HIV, that is acute HIV infection. In second stage, that is chronic HIV infection, so most of the people will not have any signs and symptoms here. Only some people have some signs, that is they will be enlarged swelling of their lymph nodes. Other than that, in second stage there will not be any signs and symptoms. And coming to the third stage, that is HIV, you see lot of symptoms here. This is a full-blown AIDS. When you have opportunistic infections, along with the opportunistic infections, you will have some secondary neoplasias or cancers, and also neurological symptoms are seen in third stage of HIV or AIDS. At this stage, you can have uncontrolled fever, you can have uncontrolled diarrhea or respiratory infections, you may have severe weight loss and other problems as well. And coming to the opportunistic infections, oral candidiasis, where you get fungus in your mouth, or hairy leukoplakia, and also molluscum contagiosum. It is one of the diseases you will find in full-blown AIDS. And also you may land into tuberculosis, herpes simplex, human papilloma virus. Lot of viral diseases and bacterial disease may infest. And coming to the neoplasms, Kaposi sarcoma is one of the common diseases you can see. And coming to the neurological symptoms, there are peripheral neuropathy. Peripheral neuropathy means you will get tingling sensation, burning sensation, entire your body, cognitive impairment, where your thinking is lost, your judgment is lost, and also meningitis and encephalitis, where you have inflammation of the brain, infection of the brain, and also inflammation of the layers that is covering the brain or spinal cord. You will have dementia. Dementia means you will not be able to remember anything, and also you will have increased risk for neurosyphilis. So it is a kind of neurological disorder. One of the serious complications of syphilis is neurosyphilis. You are at the high risk of that disease as well when you are in HIV. These are all the signs and symptoms of HIV.